Hello friends. Today we're going to discuss about fitness for work. I'm Dr. Suresh Paradmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about fitness for work from the mental health perspective. I'll also be discussing about what are the components of assessment, what is the procedure, how to take decision, drafting the report, what are the enabling and accommodation measures you need to take, and also the legal and ethical issues regarding fitness for work. Let's define what is fitness for work. Fitness for work means assessing whether an individual is fit enough to perform a designated task without risk to themselves or others in a time bound manner. Here, the time bound manner means this fitness for work is a dynamic in nature. Either the job description may vary, or it may increase, or it may decrease. At the same time, the person health condition also dynamic. It may improve, it may worsen, or else it may remain static. Hence, this fitness for work assessment is very dynamic in nature and it has to be clearly designated when the assessment was done. At least the time remains constant. To determine the match between the worker's ability and the occupational requirement is fitness for work. In simple words, fitness for work aims to maintain workers' well being by adapting work for workers' abilities, ensuring their physical, mental, and social well being. It is also called by various terms. It is also called as fitness to duty, fitness for duty, occupational fitness, fitness for employment, job fitness, and in simple words, pre employment medical examination. Many a time, annual medical examination is also conducted in various corporate sector. Evaluation of fitness for job in a person with any illness. In this video, mental illness, with or without having disability, is an important legal, administrative, ethical, and also from the perspective of individual rights, it plays a very crucial role. Every individual has a right to work, right to employment, and also earn his livelihood. Hence, whenever you do an assessment with regard to fitness for work, it can be challenged in the court of law. Hence, you have to be very careful. You need to do proper documentation and follow a thorough procedure. Fitness for work, you need to match between the job requirement and also the person capabilities. In this context framework, you also need to keep the public safety, the property safety, so that the individual's damage to their health is minimalized. Similarly, with the colleagues, the risk is minimized. And further, the economical gain is there for the employer. So, whenever you do assessment, it has threefold bearing. The first one is the employee himself, because he may be at the receiving end, not only because of the illness, but also he may lose the job. Second one is the employer, the person who pays for him. At the same time, he wants profit, or else to keep his organizational sustainability depends upon the productivity. He is the second. And the third important stakeholder is public at large. Because of illness, and if he's operating a heavy machine, he may be a risk to his colleagues and public at large. Hence, you need to keep the public perspective also into account. In simple definition, the assessment of individuals' capacity, that is both physical and mental capacity, to work without risk to their own or others' health and safety. Whenever you do a thorough assessment of both physical health Mental health has to be done. Physical health includes locomotor, neurological, hearing, blindness. From all, complete physical health has to be done. Similarly, with regard to mental health, we need to look into various capabilities of the mental capacity has to be checked. So, in simple words, fitness for work aims to adapt work to the workers and each worker to his or her job. That means you have bidirectional assessment has to be done. Now let's understand from the economic variable. The assessment of fitness for work to predict companies' future financial loss because of potential health related problems of the candidates. Example, if a person is very often sick, absenteeism, loss of pay, early retirement from disability, litigation, look at the organizational brand value, what will happen to that? Compensation, compensation claim, or else a person belonging to a company behaves very badly in public, what will be the brand value or image of the brand in public plays a important role. From the individual role, the occupational injury also can play a role. Overall, mental health is the second largest cause of work related problems after musculoskeletal disorder. If you thoroughly assess, it invariably be the first. Unfortunately, many people do not talk about their mental health at workplace. In UK, it accounts for one third of all work-related illness and is the second major cause of long-term absence in one of the important study called as Whitehall studies. And it is responsible for 20% of all retirement from the National Health Services. So there are various study looking into economic variable of fitness to go back to work. If you look at this study, invariably the person referred for fitness for work assessment, only 0.5% had psychosis, 7% were alcohol dependence, depression 8%, common mental disorders were 30%. So, my dear friends, as we know, the mental disorders is very common. Let's understand from the ethical perspective, from the economic value. If the economic comes in, the ethics will be thrown into dustbin. But however, if you're doing an assessment, always keep in your mind your ethical obligation is usually towards the patient's best interest. That is the employee's best interest. Suppose you are hired by an employer, by a company to do the assessment. You may have an ethical dilemma. Whom should I support? Invariably, ethics should go in favor of the best interest of the employee. In that case, you need to resolve this conflict and look how this employee can be rehabilitated, brought back into the company. If he is unable to get back to the work, what is the best compensation that can be offered, keeping his human rights at the topmost priority. Please remember, in a welfare state, the best interest of the employee prevails over the employer's interest. But however, never forget employees' interest versus public health interest. Suppose, as I mentioned, if a pilot is suffering from mental illness, so to support him, if you allow him to fly, he may endanger the passenger's life also. Hence, you need to keep the public interest into your perspective before you take a decision. Now, let's understand why there is a need for assessment. Before you apply an application, pre employment purpose, you have got the job, before the placement, pre placement purpose, before the promotion, or else if you have developed that illness and you need to rejoin back to duty, accommodation and enabling measures, early retirement purpose. These are the usual six different categories when fitness for work scenario comes into picture. Let's understand fitness for work request, how it comes. It usually comes from the employer and invariably it has to be in writing. The employee can also ask for fitness to work, challenging the dismissal by the employer or by the organization, or else he wants to take voluntary retirement. Many a time in various organization, compassionate ground, the job will be given to their next kith or kin. In such a scenario, fitness for work request is given by the employee himself. Many a time the court, tribunal, or insurance company can ask for fitness to work. Disability commissioner may ask. NGOs can ask when they want to rehabilitate this person by providing certain funds or a job. Let's understand what are the principles behind this assessment of fitness for work. First and the foremost is act in the patient's best interest. That means not only the interest only from the economic angle, health angle, his right to work, right to have a livelihood has to be kept in mind. The next important is assess the job requirement. That is occupational test we call. Third one is ability and disability of the person. Invariably, majority of the doctors focus on disability, but you need to look into the ability also. Remember, fitness to work is a dynamic in nature. It can be temporary. If a person has met with an accident and he had fractured his leg, now he has a temporary disability. After operation and rehabilitation, by the end of 3 to 4 months, he is fit and fine back to work. So, fitness to work is a dynamic phenomena. You need to assess the risk for others, that is, colleagues, and the public at large. Please remember, the assessment report can be challenged in the court of law because it is a right to have a livelihood. Whenever you give a report, please remember this principle. Recommendation for enabling, that is, admitting him, treating him, doing surgery, doing therapy, rehabilitation should be planned. And also, recommend for certain accommodation, such as shifting from one job to another job, shifting from night duty to day duty, shifting him near to the family members. Such kind of accommodation can be asked. Finally, there should be a logical explanation for your recommendation. Do not give your report just what you feel. Please explain logically. Now let's look into the aim of the assessment. First and the foremost is to promote and maintain workers' health and well being. Not only that, even the colleagues. Make sure the health does not decline further. Protect him from the work of risk that he may injure to himself. Make sure he adapts to the work so that what are the rehabilitation, enabling, and our accommodation measures can be taken. Now let's understand from the legal context. As I mentioned, many of the country, many of the countries do have right to livelihood. That means they have right to choose their occupation and job. If you look at the India's Right to Persons with Disability Act of 2016, Section 20 clearly says non-discrimination in employment. No government establishment shall discriminate against any person with disability in any matter relating to employment. So that means the no government will say that you are disabled, I will not give you the job. However, please remember, the appropriate government may have regarding to the type of work carried out on in any establishment by notification and subject to such condition, they may exclude certain jobs. For example, certain disabilities, a blindness, such person may not be able to drive an aeroplane or maybe even the train. Librarian, again, it's very difficult. Similarly, a locomotor disability person cannot be a policeman, army, security personnel, navy, air force pilot. That means certain job requirement to have a complete human body. In such a scenario where the public health is also at risk or public safety is at risk, then the government, by notification, can exclude them. In this regard, Government of India has notified railway job for that purpose some of the disability has been excluded. At the same time, every government should make reasonable accommodation and remove appropriate barrier so that they can have an environment where they can participate. Further, no promotion can be denied just because he developed disability. Further, no government shall demote anybody just because he had developed disability. Further, it also says that the government will identify certain posts which are suitable for disabled people and they have given reservation for them. Further, it also says that if it is not possible to adjust the employee for that post, the post some other can be given, or else he can be considered for superannuation, or else he can be kept in supernumerary post. Whenever the post is available, he can be given, or else he can be given retirement with full benefit. And the government is very clearly has said that certain jobs have to be specifically earmarked for persons with disability. Further, Section 33 also says that some of the jobs should be earmarked for persons with disability and that they need to be notified. Along with many other legislation, Employees Compensation Act of 1923, Factories Act of 1948, ESI, that is Employee State Insurance Act, Building and Other Construction Workers Act of 1996, and finally the latest, the Occupational Safety, Health and Working Condition Code 2020. The employer's liability to protect workers against occupational injury and diseases has been clearly the objective of all these legislations. So you need to know these legislation at least in principle before you embark into assessment. Let's understand what is this pre-employment versus pre-placement fitness certificate. Pre-employment, that means before you apply for a job, you need to produce a certificate that you are completely fit. It is a part of the process of an application. For some occupations entitling high physical requirement, mental health requirement, high demand is there, maybe soldier, maybe army, maybe a police personnel, maybe a doctor working in a high intensive care. In such a scenario, some of the employment may ask before you apply for the job for the fitness certificate. However, many countries say this is a discriminating in nature. Hence, they adopt pre placement. That means you can apply for the job. If you get the job, then you have to undergo the assessment. And once the assessment is done, depending upon your ability and disability, the accommodative measures, enabling measures, training, rehabilitation, and supervision will be done during the probationary period, and a suitable job will be given. This is inclusive in nature. Many countries do consider the pre placement assessment. However, please remember, United Nations clearly says that discrimination is not allowed based upon the disability. Hence, right to non discrimination with regard to employment, right to privacy and confidentiality with regard to illness, right to work with dignity, right of persons with disability, right to protection from stigma. In this regard, Mental Health Care Act of 2017 plays a crucial role for a person with mental illness when he is hired for the job. So let's understand the risk assessment. What is risk assessment? The probability of occurrence of an adverse health effect. Risk to self, that means the possibility of harming himself, that is risk dangerous to himself. Future relapse, worsening of his symptoms, worsening of his health. Risk to public, risk to colleagues. Sometimes there may be a risk for property or the machines he is using. Imagine if a pilot is flying a jet aeroplane which is costing $1 million. In such a scenario, you have to keep the assessment very, very clear. So let's look into the fitness for work components. What are those components you need to know? There is a delicate balance. You need to understand that. The delicate balance between the individual rights and also the protection of the public at large. Hence, first and the foremost, the job requirement has to be kept in mind. What are the cognitive requirement, emotional requirement, physical requirement, behavioral requirement? What is the environmental conditions under where he has to work? Whether it's a night shift, high stress, non-availability of support system, he has to work in a forest, working in the borders. What are the illness factors? Can he be dangerous to self because of his mental illness? Can he become dangerous to other, danger to public property? What are the economic consideration? Let's look into the five important components you need to assess. The first is job requirement, capacity of the person, both mental health capacity and physical capacity, workplace environment where he is going to work, risk to self and others, and even to the property, and finally, what are the ethical and legal framework under which you are going to do the assessment. But remember, all these are in dynamic in nature. Anything can change. That means assessment has to be redone whenever one of the component changes. Now let's understand about the pre-employment psychiatric assessment. Pre-employment means before he gets the job. Many a time, legally, it is considered as discriminatory in practice, in practice, and non-inclusive in nature. But however, please remember, to do the assessment, you have to have a legal mandate. The legal mandate is yes, the person before he joins for administrative post, he should not have an FIR against him, he should not be convicted by the court, or else there should be a legal mandate. Yes, the assessment has to be done. Then only you have to do the assessment. Otherwise, do not routinely do pre-employment psychiatric assessment. Invariably for army, they do pre-employment psychological assessment. If the job requirement clearly mentions, you can go ahead. Otherwise, routinely don't do this assessment. It is highly discriminatory in practice. Now let's look into the pre-placement assessment. That is, after the selection, you are doing the assessment before you place him to a job. Again, there is no need for routine assessment. There should be a request from the authority, and there is a high degree of suspicion that he has certain illness. The context of the assessment should be clearly documented. Consent for assessment has to be documented. The employee knows the consequences, and the confidentiality has to be ensured, and also he has to be told. It will be disclosed to the higher authorities for those under whom he is going to work. Job responsibilities, the requirement you should know. Person's capabilities, cognitive capability, emotional and social capability. What is his resilience? Whether there is have any conflict with law, behavior and other attitude at workplace, on-job observation report, especially if a person is in probationary period, or else you can recommend for probationary period, and then based on the 360 degree feedback, you can consider the assessment. So when you do the assessment, do a thorough detailed evaluation. Inpatient is preferable. No discrimination should be allowed. Only if exclusion is present, that means if there is very clear, it is written that person with certain illness cannot be taken, then only you have to exclude and mention, let the employer decides it. Disability reservation if it is there, and if by chance the government has notified he cannot apply for this job, a certain disabled person cannot apply, then only you have to consider this. Check for the past history, family history, personal history, history of substance use, history of legal complications, history of conflict with law. Do a thorough general physical examination. Take opinion from surgical field, medical field, if required from orthopedics. Job simulation for performance. Probationary period can be given. Serial mental status examination, ward observation, investigation for urine for drugs, CT scan, biochem investigation. Further, in certain jobs, psychological test, maybe IQ test can be conducted. resilience assessment, neuropsych assessment, and projective test. However, projective test is highly controversial in this regard. Finally, draft a report, summary of the findings has to be given, recommendation is fit for the job, need training, probationary period can be given, reassessment after 6 months, or not fit. Findings should be logically explained so that the employer knows what to be done. Please remember, this report has to be confidential. Only the relevant people or relevant higher authority should know. Hence, keep this ethical and legal requirement: consent, consequences of the assessment, confidentiality, right to get a copy of the report, transmission of the report in encrypted or a courier, know the organizational ethical and rule requirement, the country's or regional rules and regulation, RPWD Act, that is Right to Persons with Disability Act. Please remember, when you issue this kind of report, let it be given by a medical board consisting of 3 to 4 people who will do the assessment from independently or jointly they take a decision. But however, World Health Organization considers pre-employment assessment is discouraging. They discourage because it is highly discriminatory at this point of time. And many a time they are silent about this issue, but they are concerned about systematic exclusion of a person with mental illness at workplace. Hence, they consider it is a non-inclusive in nature. Hence, they discourage pre-employment mental health assessment only. Now let's move into fitness to rejoin duty. A person has got the job, he is working, and during his job, he has a mental health breakdown, or else he develops a psychiatric illness, and he has taken leave and he has come back to work. Now the employer is asking for fitness to rejoin duty. In this regard, we have done a study which was published in Journal of Neurosciences in Rural Practice, published in 2023. So this article looked into what are the variables for fitness to rejoin job from the neuropsychiatric perspective. See, we looked into the various certificates given by one of the National Institute, various occupational hazards, occupational high risk jobs. From there, the requirement came. It may be from the railway department, from the transportation department driver, soldiers, armed forces, bank manager, behavioral problem or violence at workplace, unauthorized absence from work, misuse of fund, disciplinary action, drug abuse at workplace. Many a time, a person is removed from the job, but he uses insanity as a defense. So, in such a scenario, the requisition for fitness to rejoin job was asked. So, pre-requirement for assessment is there should be a written requisition from the employer. Then you need to assess, does this domain of assessment comes under my specialty or not? Once you consider, yes, I am the right person, then you undertake the assessment. Take a written consent. Written consent includes assessment of the procedure, explaining how it happens, how much time it will take, what is medical board, what is the consequences of the assessment, and limitation of confidentiality and revealing of this report to the employer will be told. Please explain, there will be a medical board and the medical board is going to issue the report. Now let's look into the fitness to rejoin job psychiatric assessment. Do a detailed assessment, preferably inpatient. Follow mental health legislation for IP care. That means follow Mental Health Care Act of 2017. Just because employer has asked for admission, don't do admission. Ask for the person. It can be section 86 or it can be 89. Take a referral letter. Give referral to other medical field or surgical field if required. Ask clarification from the employer why they have referred him. Look for the chief complaints, history of presenting illness, past history, family history, personal history. What was his premorbid personality at work? What was his work performance? What was his duty responsibility? Was there a lapse in his duty? Was there any disciplinary action at his work? General physical examination? But however, this part of the assessment we usually don't do. That is job related history. This job related history should be taken from the manager, colleagues, friends, and family members. It can be either collected by in person or else the psychiatric social worker can go to the office visit and do the assessment, or you can do online also. Ask for the job performance report. Was there any award promotion given in the past? Was there any illness and behavioral problem at workplace? Abnormal behavior at workplace? How was the social behavior? What was the skills required? Was there any recent absenteeism, violence, substance use? Check for his social media posts. Was there any change in his social media? History of substance use? Any legal issues? Any FIR has been done? Has been removed from the job? Those assessment has to be documented. Do a serial mental status examination, so serial mini mental status examination, cognitive assessment, ward observation, workplace visit if required, maybe 2 3 times, take consent if required. If it is from a highly sensitive job and the public at large at risk, then you may have to consider to go and do the assessment by violating the confidentiality also. This comes under the right to confidentiality under the Mental Health Care Act, which clearly says that if the person with mental illness is at a high risk of public danger, then you can violate the confidentiality, but it has to be very clear. You don't disclose about his illness matter to the employer. Do appropriate investigation and do appropriate psychological assessment. Once you do the assessment for a period of 2 to 3 weeks, based upon your experience, based upon the report, based upon your observation, you have to issue the summary. That summary has to be presented in front of the medical board. Medical board will do examination of the person, and then they will issue the report. The report will mention the diagnosis, what is the comorbidity if is there, and also opinion can be given. This certificate is either temporary or permanent. Temporary means reassessment after 3 months or 6 months. That means there is a possibility that he may improve, or else to see whether it may worsen further. Hence, the opinion has to be given: he is fit to job, fit to resume back to duty, fit with environmental modification and reassessment after 3 to 6 months, and he is not fit. Further recommendations can be given. The recommendations can be enabling measures, accommodation measures, and also conditions can be placed for continuing to be fit for the job. Now let's look into the enabling measures. Enabling measures can be to treat the comorbidity, physical comorbidity, other mental health comorbidity, unexplained, unexplored treatment can be considered, medication, surgery, physiotherapy, occupational therapy, rehabilitation, counseling, psychotherapy, time for rehabilitation, graded resumption of responsibility, refamiliarizing and retraining, periodic review of the case. So these kind of enabling measure will help the person to get back to the job slowly over a period of time. Accommodative measures, modification of duty hours, working hours, impact of medication considering that he is going to be sedated, asking him not to do the night duties, redeployment to the existing vacancies, maybe lighter job, desk job, modifying or providing certain equipments so that he'll be able to do is complete to his efficiency, providing supervision, substitution of the hazardous things around him, information, instruction and training, and regular follow up are the requirement. Conditional measures. You can give a report telling that he needs to be on regular medication, supervised medication, regular follow up, blood and urine test to be done periodically, and the certificate becomes null and void if he takes alcohol or drugs or he stops medicine. These conditional measures can be placed in the medical certificate. Now let's look into the factors that play a crucial role in decision making. The first and the foremost invariably what we miss is job requirement, physical requirement, cognitive requirement, emotional requirement, behavioral and social skill requirement. That means you need to do the assessment keeping the employees' health perspective and also the public and colleagues' health perspective also. Environmental factors, whether there is a social support, family member support, supervising his medication, looking for relapse, bringing him for follow up, whether there is any stressful environment in his workplace, night duties, highly stressful job, whether he can be placed in a different under a different manager who is accommodative, whether a job is highly on the edge, being a soldier, high media criticism, or else he's a political leader. So, if he's in a highly stressful environment, can it be shifted? Extreme weather condition also to be considered. Illness factor, whether he has schizophrenia like symptoms where he was dangerous to self and others and property in the past, psychopathological symptoms, whether he has delusions and hallucinations against his employer or else public at large, then he becomes completely unfit, frequent relapse, and every relapse comes with a high threat to the society, conflict with law, need for continuous medication for longer duration. In spite of medication, he is not improving, need for rehabilitation. Above all this, he refuses to accept that he has mental illness and refuses to take medication. In such a scenario, we have to give unfitness certificate. This has to be clearly documented why we are taking this decision because it can be challenged in the court of law. Hence, remember consent, confidentiality, and also if he is going to be harm to others, that needs to be disclosed to the employer and the relevant person. Please understand the requirement of Right to Persons with Disability Act, Mental Health Care Act of 2017, job requirement, whether there was any conflict with law in the past, and check whether there is any personality change. If he has antisocial personality change, psychopathy personality change, then we may have to consider that is unfit for certain jobs. To conclude, my dear friends, fitness for work should be a comprehensive assessment of mental health and physical health. You need to understand that this assessment is not only with regard to the employee and the employer. We need to consider public at large. What is the risk? This can be the report which you are going to give can be challenged in the court of law. Hence, document properly and invariably, whenever the employer versus employee is there, error on the side of the employee. Whenever there is a conflict of interest between the employee and the public at large, error on the public at large. So, these principles you need to keep in mind. But, however, have a medical board within the hospital or maybe within the unit so that you give a opinion, collective opinion rather than an individual opinion. And remember, this opinion can be challenged in the court of law. Always remember, you need to be objective in your assessment and giving the report. Hence, always have this in mind. You need to promote and maintain workers' health and well being, prevent their health decline, protect them from the risk, and also the public at large. Make sure the worker adapts to the work, and also the work has to be made sure the person is capable of doing that. So, accommodative measure, enabling measures, and conditional factors can be placed when you issue the report. When you issue the report, diagnosis is must. The opinion can be permanent or temporary. It can be fit, it can be unfit, and unfit with certain enabling and accommodative measures. And your opinion should be logically explained. Thank you very much for giving your valuable time. Stay safe.